All right. So, hello everyone. I'm your host Ashley Vincent, and welcome to the seventh episode of A Doctor's Aspects on Healthcare. We have a very special guest here with us today, Dr. Sarah. Thank you so much, Doctor, for taking time out of your day to speak with us. So let's get started. How are you doing today, Doctor?
Thank you so much for having me. I'm really excited to speak to you guys today.
Okay. So, would you like to tell our viewers a little bit about yourself and your specialty?
Sure. So I'm a family doctor. I live in Toronto, Canada. I did my undergraduate degree in biochemistry from the University of Ottawa, which is in Canada, and I did my medical school degree from there as well too. And I came to Toronto, Ontario, to do my residency in family medicine, and so that's where I practice right now.
Okay. Can you tell our viewers once more specifically where you're located and where you practice?
Absolutely. So, like I said, I do work in Toronto, Ontario, which is in Canada, and I work in two clinics. So I actually work as a family doctor in a clinic in the community. I mostly deal with in a low socioeconomic area, and I see patients from basically the time they're newborn all the way till I think my oldest patient's over 100. And I also do cosmetic like non-surgical cosmetic procedures. So I work as a medical director in a cosmetic clinic as well too, both in Toronto, Ontario.
Okay. So what led you to pursue medicine? Is it something you always knew, or was it a specific moment which led you to make the decision?
Yeah, it's a great question. So I think I always wanted to be a doctor, but I didn't really know if I was going to get in, or would I always continue to like it as I kind of grew older. I think a moment that really solidified a lot of things was actually in grade 11. I had to dissect a fetal pig, and I realized that I just thought it was so fascinating understanding how the human body works. And I just realized a lot of my classmates were maybe not as intrigued. And I think I also always wanted an occupation where I was able to help people. So I think my interest in science and how the body works, and combining that with an occupation where I could help people, I think I felt like this was the right path to go, and I think I'm pretty happy where I am.
That's really cool. So, what is your opinion on healthcare in Canada? What are its strengths and weaknesses according to you?
Also, great question. So, the healthcare system in Canada, it's a public healthcare system. So we call it sort of, you get free healthcare, although it's not exactly true. We just pay higher taxes than, for example, people in the United States. But what it does mean is, especially for me as a doctor working in a low socioeconomic area, it means that I don't have to really worry about whether or not a patient can afford to come and see me. I don't really have to fight to see whether they have insurance. It also means that when I'm trying to organize some tests like an X-ray, ultrasound, blood work, etc., that I'm not so worried about whether or not people can afford that test or not. I can just order the test, and that, which is really nice. I think the weakness in the healthcare system here is the fact that, I guess, because it's sort of government run, there is a level of bureaucracy in the sense that there's you have to go through, everything is run through the government. So some programs, it's really difficult to get access, especially for mental health. I find that getting access to a psychiatrist, also specific programs like trauma-based programs for people who have had PTSD and other mental health issues, it's really challenging to get access to that. And I think sometimes the bureaucracy comes from the fact that there are people who are involved in the decision process that maybe are not working, so like at the level where we are as doctors, like working, with patients directly. So I'm not sure that they always understand the best way to be able to get access for some of these patients.
Okay. So, how do you think the healthcare access can be improved?
Yeah, I think the issue that we have here is in Canada, especially, I think we almost don't have enough doctors for the number of people that we have here. So I've eventually, I've been in practice, I think this is my 7th year. I've eventually had to sort of close my practice to new patients because I just can't keep up with the demand of everyone that sort of wants to be seen. So I think, one part would be to basically have more physicians, especially I think, here, I think we definitely still need a lot more family doctors being able to, be there at the front lines, sort of like helping patients. We have a lot of walk-in clinics, which I don't know is the best care, which walk-in clinics are basically, you come in with one issue, you deal with the issue, and then, you may not see that doctor ever again. Whereas the way I sort of practice medicine is that I have a continuity of care. So I see patients, I can see them for years as they go. So I get to know them and they get to know me. And I feel like that really helps out with our relationship. So obviously, I think that's part of it. I think probably other thing would be having more money or resources put into healthcare, I think. Yeah.
Okay. So now let's talk about the biggest predicament, the COVID-19 pandemic. So how has it impacted you professionally and personally?
So I have to say, personally, in the beginning, I don't know if I felt so much of a difference. I know I wasn't able to interact with certain people, etc. But I think by December, so like just a couple months ago, I really had a lot of burnout, and it's because I didn't really take that much time off. I just felt like I had to keep on going for patients, and I thought, if I'm not traveling anywhere, I might as well work and help people out. But I think at some point, I think we all need a break from all of this, and so I think that was difficult. I think professionally, though, it's been a very interesting time for all of us doctors. But for me as a family doctor, I'm used to seeing people in clinic. That's been always our practice. And now I only go to see patients probably once a week in the clinic. And so I have to be really selective of who I bring into the clinic. So, maybe I'll bring in the, babies who need immunizations, maybe some diabetics or people who need to get their blood pressure checked and they don't have a machine, pregnant women, people who have rashes, but it's very different. And, the relationship that you get from someone when you see them is very different than when you just, I'm mostly calling patients. So, talking on the phone, you don't always get the same, understanding of a situation. I'd say that still I'm impressed that I can still do maybe 85-90% of my job pretty well. I can send people requisitions to do their blood test or any test they need to do through email. I can send a prescription to their pharmacy. So I mean, it's not ideal, but I think we've been able to manage pretty well considering.
Okay. So you're like making it work.
I mean, you have to. I mean, I think it's one of the scenarios where, people's problems are going to continue to happen. I know that I'm seeing a lot more mental health as well, too. It's difficult. I mean, we're all kind of anxious about, what is our life going to be like? How are we going to be impacted? So I'm not surprised. I'm seeing a lot more mental health as well, too. But you just try your best. And I think everyone understands that. I think patients are just happy to have, that we're still kind of open and being able to sort of see them.
Okay. So do you think the pandemic has affected the access to healthcare in any way? If so, how?
Yeah, so I think in the beginning, I felt that not a lot of my patients were calling in. I don't think people knew that we were open. I know a lot of people were really nervous about going to the emergency if they thought they had something. So I'm sure we've probably missed certain emergencies. Now I think because it's been over a year, well, it's almost coming up to a year, I've become really busy. So I feel like a lot of those patients that have held on to problems for months at a time, I think they're now sort of realizing that they can't hold off on it as much, and people are still going to the hospital. But what's really I find impressive is even from talking to someone on the phone, you can kind of get an idea of whether something is an emergency or not. So I think that in this past year, I maybe have had to send 2 or 3 people to the hospital only. Like everything else I've been able to do remotely, which is actually quite impressive. And the goal would be to try to keep as many people away from having to go to the hospital. It's very different. I've had to send a lot of people who, perhaps have COVID symptoms. It's very different, but people who didn't have COVID symptoms, been pretty lucky that, we're trying to keep as many people out of the hospital as possible.
Okay. So what is your opinion about the COVID vaccine?
Yeah, so great question. So I'm a big supporter of the COVID vaccine. I will say though that, when they first sort of approved the vaccine, I was also really hesitant. I didn't know, I think it's probably because I wasn't that educated on it. I didn't really know or understand it that well. And I'm lucky because obviously I have a, science background, a medical background. I was able to really read the studies, understand what the studies are sort of telling us. And, based on what we see, that, the studies are, somewhere between 8,500 to over 22,000 people who are involved in these studies, patients. And if you look, like none of the patients who got the vaccine, none of them died from COVID, the vaccine, none of them died from COVID, and none of them died from none of them required any hospitalization. So the fact that, we're still seeing people who are not vaccinated, they're still going to the hospital, there are people who are still getting COVID, obviously, and still dying from COVID. The fact that people in the study, like no one's dying from getting COVID, those are like really, really strong support for getting the COVID vaccine.
Okay. So can you tell our viewers a little bit about your experience in receiving the COVID vaccine?
Yeah. I think I received my COVID vaccine about 3 weeks ago. No, a little bit over 3 weeks. So I was supposed to get my actually second dose last week, but if you can imagine, we didn't have enough supply for my second dose. So I'll tell you about my first dose at least. So really, the only symptom I had was a little bit of arm soreness. It lasted about 24 hours. I know a lot of people can get, if you look at the side effects, potential side effects are like fatigue, malaise, you can get fever, you can feel like pain at the actual site where they did the immunization, you can get redness there. It's all part of the immune reactions. Those are all things that, are possible and are actually normal. It's your body trying to get an immune reaction from the vaccine so that it's able to protect itself. So those are all normal things. I have to say my experience was, you go in obviously nervous about what may happen, but honestly, it wasn't really that bad. And I'm hoping to get the second vaccine soon. I think we're delayed about a week, but I think it should be okay.
Okay. So this is my last question. So do you believe that the education we are receiving on how to protect ourselves against COVID and the vaccine is adequate? Is there any information you would like to emphasize on that you think everyone should know?
Yeah, that's wonderful. So, I think, unfortunately, there's still a lot of people who don't believe that COVID actually exists. I think people still think that it's a hoax. I feel at this point, if it's been over like close to a year, I feel if you don't really believe in it, I don't know if I'll really be able to probably convince you otherwise. It's just like I have patients who, I'll try to explain something and they may not be believers, and that's fine. But for the people who are sort of like hesitant, I think, the information that we really want to be able to sort of spread is the fact of the safety aspect of the vaccine. I've actually, it's interesting. I follow a lot of doctors on Instagram. I've seen allergists who have allergies who've had the immunization. I've spoken to a lot of them who are experts in their field. So, I think the main thing to sort of consider is the fact that, almost all people should be considered good candidates to get the vaccine. There's talks about whether or not it can cause infertility. There's nothing to suggest that. There's thoughts about whether pregnant women or people who are women who are breastfeeding are able to get the vaccine. Again, they should be offered the vaccine just because of the fact that women who are pregnant are considered higher risk. So we don't want them to get COVID, right? We want to be able to protect them and protect the baby. Again, everyone should just make sure that they talk to their doctor to make sure that they are good candidates, etc. But, I've heard that, the vaccine can change your DNA. It can't do that. The types of vaccine that it's an mRNA vaccine. It's actually a vaccine that's been studied for a really long time. All the proper steps were done in the actual research itself. So I think some people are worried, like, was it done too quickly? But they followed all the right protocols. They have big numbers of people who are involved in the study. So it's really, I think a lot of it is really reassuring. I think the one last question that I remember I had from someone, which is interesting, which is how come, after we get the vaccine, we're not able to, take off our masks, etc. And so the reason is the fact that when we get the vaccine, so for example, once I get my second vaccine, hopefully it's a Pfizer vaccine, I should be 95% protected. But there's obviously still a small chance that I may be able to get the COVID or I may be able to transmit it, meaning like to give it to someone else. And so if I give it to someone else who doesn't have the vaccine and then they give it to someone else, we're just doing the same problem. We're creating the same problem again, right? So, the hope is that if we do immunize the majority of people, we get what we call herd immunity. And so majority of the people are now protected. And so then eventually the goal is to limit all these precautions that we have. But unfortunately for now, the goal is really we have to immunize more people before we're able to kind of reduce those protocols in place. But I think those are a lot of the questions that I've been asked a lot. So I think those are the things I've been trying to tell people about.
Okay. So that's all we have for today's interview. Thank you so much, Dr. Sarah. It has been wonderful talking to you, and I'm sure everyone watching would have gained some valuable knowledge. And lastly, I'd like to thank all our viewers, and please remember to stay safe. And again, thank you so much, Doctor.
Thank you so much for having me. I appreciate it so much.